Well, health officials are calling on people to cancel their plans to travel for the Thanksgiving holiday due to concerns over surging cases of COVID-19.
But not everyone has canceled those plans. Joining us now to share some advice if you will be seeing some loved ones for the holidays is Dr. John White. There he is. He is the Chief Medical Officer of WebMD. So we have heard the warning, sir, that perhaps people should change those plans that they had for Thanksgiving. What would you tell them? Would you agree with that, or is there a way to do it safely?
I would definitely agree that if you can avoid a family gathering with people that typically don't live in your household, you should do that. You got to remember, cases are going up, hospitalizations are going up. It's not going to change unless we do something about it. And it's a respiratory virus. You catch it from other people. So how do we minimize the risk? And, I'll tell you, I recognize that some people are still going to do this, against advice, but they're still going to do it. So how do we keep them safe while also keeping them sane? So what I've been telling people is if you're still going to do that family gathering, hopefully it's less than 10 people. If there's elderly people or perhaps people at a higher risk, you might want to consider getting a COVID test a couple days beforehand. And the reason why I say that is not as a get out of jail free card, do what you want, but if it's positive, game over. You're not going to go to any family gathering and you're not going to have anyone over to your home. We say it's better to do it outside than inside. It may not be practical with the weather, but you can still open the windows in your home and get some good ventilation.
Can I ask your thoughts?
Yeah.
We're seeing as indoor dining in Illinois has been, basically restricted. We're seeing lots of tents popping up everywhere. The guidelines say you should have 2 of the tents sides open, but not a lot of places are doing that. Is that more dangerous than just eating in a restaurant to begin with?
If the tents aren't going to have those sides open, that's going to be a challenge because the whole point is you want ventilation. What's the ventilation and filtration system in a tent? It may not be as good, as a restaurant. So you have to follow the guidelines. You have to continue, to have those tables, 6 feet apart and try not to be right up against other people. It's a respiratory virus. Let's remember that. That's how it spreads. So let's do things that are going to avoid our susceptibility of getting infected.
Yeah, let's get back to some of these ideas. If there are people at home that are having some gatherings, let's say you've got a grandma that lives alone and perhaps she has to come over to your house. How would you change sort of how you serve that individual? What would you do? Because I'm sure there's some advice that you have there as well.
Yeah. No buffets this year, right? No sharing of utensils. Plate it for everyone ahead of time. Ask them what they want, and then one person's in charge of plating it. Remember, and some people are still doing this, when we used to have kids' tables, nobody wanted to be at the kids' tables. This year, you should have a kids' table, and you should have an adult table. And you might want to have 2 adult tables or 3 adult tables, make them, smaller, but maybe what you're going to do is have families that live together do that. And then you could have a bigger gathering, maybe in the driveway with, your desserts. Do something like that, trying to be creative. If you're not typically living with the folks that are coming over to your home or you're traveling to, I'm going to recommend that you wear a mask while you're not eating or drinking. I also suggest you limit it to just a few hours. And you know what? That might be good for your mental health.
He said it, not me.
Normally,
Dr. White said it's time to go.
Normally the specials we do are like, how do you get along with your in-laws over the holidays? And now it's how do you avoid getting COVID?
You know when to leave.
Yeah.
After
Dr.
3
John
hours.
White from WebMD, thank you so much. We appreciate you joining us.
Thanks for having me.